So you being an orthopedic surgeon, now if we look at some extreme ways of increasing a height, does surgically height growth is possible?
Again, the question which I get asked all the time, the answer to that is yes. If somebody comes to me and says, "Doctor, can you increase my height by doing some operation?" The answer is yes. But would I do it? The answer is no. If a patient is not so tall, let's say 5 feet, 5 feet 2 inches, there is no way we can, advise or recommend the patient surgery, even though by cutting the bone, there is a Russian technique called as the Elizarov technique, where we do a corticotomy and then, distract the bone. And the height can actually increase. And the height can increase up to 6 centimeters, 7 centimeters, 10 centimeters, or even up to a foot. And there have been examples of people getting that done. But please, even though it can be done, it's a strict no. Your height is determined by your genes, it's genetic. Don't try to play with Mother Nature and ask your doctor to increase the heights, because there are complications associated with this. So to answer your question, surgically height can be increased, but I definitely don't recommend it to be done. Just as a follow-on to this, well, do we use this height increasing technique in some patients? Yes, we do. If there is a congenital defect and one leg is shorter than the other, then to correct the limb length equality, then we can increase the height of that particular short bone. Especially we see it in the tibia or the femur, where there are some congenital shortening in the hip, or proximal focal deficiency, or in polio, or certain conditions where the leg is short. Or inherently, sometimes we see that patients are just born with one side short. In them, we can do this Elizarov technique where we cut the bone and lengthen it and then make both the limbs equal. So in that, I will advise it and I will do it, but not in a normal patient just to increase the height.